Okay guys, today we're caring for a patient in room 2. She's 28 years old. She just got diagnosed with Crohn's disease. She just got a colostomy put in. She's very self-conscious about it, doesn't like to take care of it. So today our main goal is just to go in, get it cleaned, show her how to clean it, show her how to care for it, maybe talk to her husband a little bit, show him as well. She's really self-conscious. I mean, really self-conscious. She doesn't like her husband to see it, doesn't like him to be around it when they're changing, so we just gotta be very aware of that and make her and her husband as comfortable as possible. So we'll give her the medications we're gonna give her, we'll go over community resources, and just go over how to clean that colostomy and care for its wound. Sound good?
Okay, sounds good.
Sounds great.
Okay, so I'm going to go ahead and take you in to see your wife. I will let you know she's very sensitive right now, so I just want you to be prepared, okay? She's like really sensitive about her situation that's going on. But are you ready to go in?
Okay,
Okay.
let's go in.
Knock, knock, knock.
No! No!
It's just your husband.
No!
It's just your husband.
No!
It's just Enoch.
No!
No.
No!
No.
No!
No.
What's wrong?
No!
I think we should give Taylor some time.
Get out! Get out!
How much time is she gonna need?
How you feeling today? Still not feeling too good. Well, we're just gonna take your vitals real quick. Can you verify your name and date of birth for me?
Taylor, 814.
It'll get better. Doubtful. Just take this. I know your husband's really excited to see you.
I don't want him to come today.
He's got to come see you at some point.
Nope. I might as well just divorce him.
Taylor.
Bye-bye, Felicia.
And then if you just want to take your temperature.
Yeah.
Go.
Okay. Good morning. Can I have you state your name and date of birth, please?
Taylor, 814.
Okay, perfect. I'm just here to talk a little bit about your ostomy and how to care for it.
Can you just get rid of it?
No, we can't get rid of it. However, but I just want to tell you what's normal and then some things that you should call your provider about. So it should shrink or go down in size in about 6 to 8 weeks, and it might be a little tender or red, but that's normal. If you notice any discharge, however, you should notify your provider, or if it turns black or purple, you should also notify your provider. But daily, if the bag gets about halfway full, you should empty it out. You shouldn't let it get more than halfway full. And then you're going to change the actual bag itself every 3 to 7 days.
Okay.
Okay? And then your stools are going to look a little loose and runny and watery now on. That's normal. It's completely normal.
Yeah.
However, if you notice blood in your stool, you would also want to notify us.
Okay.
You're just going to want to rinse it daily.
Rinse what?
Rinse your ostomy,
Oh, okay.
okay, daily, just with tap water. You know, you can use
Mhm.
some soap if you want. And then if it gets irritated or blistered, remove the pouch carefully and consult a nurse or a provider about it, okay?
Okay.
Do you have any other questions?
No, I guess not.
No?
No. Don't tell my husband any of that.
Okay.
I don't want him to know.
Okay, so now I'm going to help you to actually show you how to clean and change your ostomy bag, okay? So I'm going to close the curtain for privacy.
Can I come in, huh?
No, get out.
Okay, Taylor, we're just going to go over your medications real quick on what you'll be discharged with and taking at home. So first you'll be taking Lovenox. This will help prevent any blood clots. You'll take this subcutaneously in the lower abdomen. You can really just lift up your shirt, pinch some skin, just jab it in, inject the medication, and that's how you'll do that. Some common side effects you might see, you might get have some bleeding, fever, some fatigue, some confusion. You might have a little trouble breathing. These are common side effects, so nothing to get too concerned about. when you give it in your lower abdomen after you're done, make sure you want to dispose of it in a proper receptacle, different from your other trash, just because you don't want needles in your trash. If you miss a dose, take it as soon as you can, but if it's close to your second dose, just wait, take your second dose. Don't double up your doses. Some side effects you might want to report to your provider if you have blood in your stool, if it's black stool, you want to notify your provider. If you have any red or brown urine, if you have any red spots on your skin, any unusual bruising or bleeding in your gums or nose. If you get severe chest pain, shortness of breath or swelling, or warmth in your lower extremities, you might want to notify your provider. If you have difficulty seeing, confusion, trouble speaking, trouble understanding, severe headaches, or sudden numbness, you'll also want to notify your provider of those. And don't worry, we'll be giving you papers about all this stuff, so you won't have to remember everything I tell you, but we just want to go over some basics. And then the second drug you'll be taking is Corig to help with your blood pressure. You'll be taking this by mouth twice a day. You might feel a little weak from this one too. You might have diarrhea, dizziness, trouble breathing, fatigue, weakness. You might gain some weight. Those are all common, so don't get too worried about those. You might want to take this with a glass of water. And don't take this medication more than prescribed, and don't stop it frequently because that can lead to severe complications with your heart. So you'll want to look for any allergic reactions you might have to it: itching, bumps, rashes, hives, swelling of your face, lips, nose, those kind of things. You'll want to notify your provider. If you're allergic, we don't want you taking them. And then you might get drowsy or dizzy taking this, so try to avoid taking it before you're going to go driving or taking it before you go to work and have to operate any kind of heavy machinery. So
How am I supposed to work with a colostomy bag?
it will be something you have to get used to, but many people have done it, and we have faith in you that you can do it too. So, and you also just want to check your heart rate and your blood pressure regularly with this, because if it drops or elevates, you want to notify your provider of any of those kind of changes. So, well, again, we'll be giving you pamphlets and papers with all this information. So, do you have any questions right now?
No, thanks.
Okay, well, your other nurse will be in to help you, give you some community resources, and maybe those community resources will help you get more comfortable with your colostomy.
Okay, well don't flick it. Okay, the redness and the swelling is gonna go down, and things will get better. Okay.
It looks disgusting.
It's okay. It's okay. It'll be okay.
It looks disgusting. It's so
Oh
gross.
my goodness.
It's like a concierge nurse. You call them and they come and help set you up.
Knock, knock.
Hi, Taylor. My name's Alyssa. I'm just here to give you some community resources to help you go home. I heard
I'm never going home.
you are. We want you to go home and be healthy.
Oh, that was bad.
Okay, so I heard that you are a little nervous about going home and caring for your ostomy. So I've got some community resources here for you. They both have online websites, so you can go and the first one is called United Ostomy Associations of America. It has...
It's all about these freaks?
Yes.
We're all freaks together?
Yes. It gives you a big base group to connect with. It gives you diet and nutrition, how to live with it, put clothing around it. You know, there's bathing suits, there's lingerie, there's everything for an ostomy. It even talks to you about your sexuality and how to be comfortable in your skin while you have an ostomy bag. There are support groups and a live chat where there's a forum where you can put all your information up, questions you have, and other people can give you that information that they learned as well.
Oh.
So here is the pamphlet for that. And then the second resource we have is Wound Ostomy and Continence Nurses Society. So this is also an online website, but there is a phone number and you can call nurses that are specialized in ostomy care, and they can come out to your house, help prep you, show you how to care for it, how to clean it, how to dress it. And anytime you have any concerns with it, they can come to you and show you, or you can talk to them over the phone and get all the information. And this also has all the community resources. There is a group that meets in Overland Park that you can go to, and it has a support group, and spouses are welcome. And you can get all the information you need from that. And there's also patient testimonials about how the nurses help and all the benefits that it provides.
Oh, that's helpful.
Here is
Since
that
I live
for
in
you.
KC.
Okay, do you have any questions about anything?
No.
No? Okay. Well, then I will go fill out the rest of your discharge paperwork, and we'll get the other nurse in here to help you get discharged.
Okay, thanks.
Okay, Taylor, we went over your medications, community resources, and how to take care of your ostomy. Do you feel comfortable going home?
I guess.
Okay, well, I'm going to finish up your discharge papers, and we're going to get you out of here as fast as possible, okay?
Okay. I'm so funny. Man, I'm so funny. Okay. Aww.